This weekend, Dr. Glenn Galehood will run his 45th Marine Corps Marathon. He's only missed it twice, but he's up for almost any race. He saves his medals, but his true passion is saving lives with his nonprofit Mission to Heal. It brings medical supplies and training to the most remote corners of the world.
We have done what we can to help, not just to heal the folk that we see immediately by cutting and sewing, but by teaching those skills such that it continues beyond us.
The doctor is reminding us all that age, baby, ain't nothing but a number. Hell, I couldn't even run a marathon. This man done ran 170 races on all 7 continents. That's impressive. You better go, Doc. Do your thing. And then on top of that, what is even more impressive than him being able to run marathon after marathon after marathon on all 7 continents is the fact that he is using his run as part of his ministry to get universal health care. The Mission to Heal describes itself this way. We are a nonprofit global medical missions agency that heals underserved people and trains local practitioners in the most remote and needy areas of the world. 2 billion people worldwide have no access to safe surgical care. Mission to Heal teams travel to where medical need is great and where medical help is under-resourced or non-existent, providing healthcare that is evidence-based and patient-centered. Doctor, you doing that? I am very, very impressed with this, right? Not just his running, but this too. And here we go. This marathon is a good metaphor because it takes discipline, it takes effort, and it takes a commitment. That's what health care is, and that is coming from the good doctor himself, Ray?
It's just so good to see somebody connect their passion to their, other passion, I guess. His passion in running, he found a way to connect that to his passion in providing services. And, I'm glad that it was covered on the news because, it's good awareness. It's good to shed a light on the mission of his organization and what they're doing. But, to remind people that everybody deserves quality health care. Everybody deserves dignified healthcare and the quality treatment, regardless of location, regardless of income, regardless of age.
Yeah, that is exactly right. And the fact that in this country, we are the only industrialized nation that does not have some type of universal healthcare. We spend more for our healthcare in this country and we do not get better or even equal results. We are the only industrialized nation that does not use the bargaining power of the federal government to bargain for lower prescription prices, to slap down these pharmaceutical companies that price gouge even at the risk of killing people. We don't do that in the good US of A. And so that's why we need people like Dr. Glenn and his organizations and others that are doing this work, that are bringing up the rear, because the federal government has yet to get a clue that in the 21st century, it is backwards as hell, and especially in the face of a pandemic, which is not over. The height of it may be over, but the pandemic is not over. And certainly the ripple effects, the impact of the pandemic, both on individuals and small businesses too. As we leave out our small businesses, individuals and entrepreneurs are still suffering. If you are not a multi-million-dollar corporation, you're not getting loans and stuff that you don't have to pay back. Hello? So the fact that in this moment, leaders, particularly the Democrats, did not take the opportunity to just go ahead and go big or go home and push through universal health care makes no sense, right? At all.
Yeah, absolutely. Couldn't have said it better. And I'll say even in America, when we're talking about the missions that this man's doing around the globe, I think that we often think about the people who are desperate for these services as living somewhere remote. Organizations like this do missions in West Virginia, in rural West Virginia. They have to provide these free, dental services, which for some of those West Virginians is the first time they've ever been able to go to the dentist in their life. And that oral care is part of healthcare. It is a fundamental part of keeping yourself healthy.
That is exactly right. And the fact that with Medicare as it exists right now, our elders, our senior folks, our seasoned people, they have detached dental and eye and hearing, and it doesn't make a whole lot of sense.